The year is 1848. A doctor stands before a room full of colleagues holding data that should have changed the world. Death rates cut by 90%, proof on paper, evidence no one could argue with. He wasn't celebrated, he wasn't promoted, he was laughed at. And the women who kept dying in those hospitals, nobody cared enough to ask why. This is the story of Ignaz Semmelweis, the man who discovered one of medicine's most important truths and was destroyed for it. To understand what Semmelweis faced, you need to understand what hospitals were in the 1840s. They weren't places you went to get better. They were places the poor went to die. Vienna General Hospital, one of the most prestigious medical institutions in Europe, had a maternity ward so deadly that women in labor would plead to be turned away. Some gave birth on the street outside rather than walk through its doors. And the strange thing? Right next to it, same building, same city, was a second maternity ward with a death rate 10 times lower. 1 in 10 women died in Ward 1. 1 in 100 died in Ward 2. Nobody found that strange enough to investigate. That detail will matter. Remember it. Ignaz Semmelweis arrived at Vienna General in 1846. Hungarian-born, ambitious, sharp. He was assigned to Ward 1, the deadly one. And from his first week, something gnawed at him. The patients weren't just sick. They were dying of something specific, childbed fever. A brutal infection that spread through new mothers after delivery. Fever, agony, death within days. Semmelweis began studying the numbers. Obsessively, he noticed patterns others had dismissed. Ward 1 was staffed by medical students and doctors. Ward 2 was staffed by midwives. That was the only difference. But why would that matter? In 1847, Semmelweis's close friend, a pathologist named Jakob Kolechka, died. Not from childbirth, from a scalpel nick during an autopsy. The infection that killed him, identical to childbed fever. Semmelweis stopped cold. The doctors in Ward 1 spent their mornings performing autopsies on corpses, then walked directly to the maternity ward. No hand washing, no change of clothes. Just hands that had been inside cadavers, now delivering babies. The midwives in Ward 2 never touched corpses. That was it. That was the answer. He called it cadaverous particles. Invisible matter carried from the dead to the living on unwashed hands. He was describing germ theory. 15 years before anyone had proved germs existed, Semmelweis didn't wait for permission. He introduced a new rule in Ward 1. All doctors and students must wash their hands with chlorinated lime solution before examining any patient. The results were immediate. Within months, the death rate in Ward 1 dropped from 18% to just 1%. He had done it. He had the proof. The numbers were undeniable. He published his findings. He wrote to doctors across Europe. Now watch what happened next, because this is where history turns dark. The medical establishment rejected him. Not because the data was wrong, not because the logic failed, because accepting it meant admitting something unbearable. It meant admitting that doctors themselves had been killing their patients. Men of science, men of status, educated hands spreading death without knowing it. The pride of an entire profession was at stake. Leading physicians called his theory absurd. One prominent doctor said washing hands between patients was simply impractical. Another insisted that a gentleman's hands could never be a source of disease. Semmelweis wrote back with fury. He called his critics murderers. He sent increasingly desperate, angry letters across Europe. The establishment closed ranks. He was removed from his position in Vienna. He returned to Budapest, continued practicing, continued preaching. But the obsession consumed him. He grew erratic, unstable. The weight of being right had been ignored, broke something inside him. In 1865, Semmelweis was committed to a mental asylum. He was 47 years old. 2 weeks after being admitted, he died. Likely from the same type of infection he had spent his entire career trying to prevent. History is still debating whether it was from a beating by guards, whether it was neglect, whether anyone truly knows. What we do know, within 2 decades of his death, Louis Pasteur and Joseph Lister confirmed everything Semmelweis had said. Germ theory became the foundation of modern medicine. Hand washing became standard practice worldwide. The man was vindicated by history, just not in time for it to matter to him. Sometimes the truth arrives too early to save the man who found it.